do you find out when a patient comes in and says, you know, I've had this painful total ankle for a while, you know, where do you start with that? How do you work it up? So here's my disclosures. So first of all, I just want to say, as a whole, as total ankle replacement surgeons, how are we doing? How do we compare to our total joint, hip and knee colleagues? And this is a couple of slides from Anish Kadakia that I borrowed from him. National Institute for Healthcare and Excellence in the UK did a survey, kind of a meta-analysis of their cases through, I think it was through a registry. But anyway, the 10-year revision rate was about 5% for hip and knees, all pulled together. So an annual revision rate of not much. So we know that they're still trying to improve that rate, but how do we compare to that? So first really study about second generation total ankles that was published was by Steve Haddad and Chris Coetzee back in 2007. They published this article in JBJS. And again, it wasn't that encouraging for those of us who do total ankles. The second generation implants, 23% failure rate. These are good surgeons who are doing this. And so obviously we needed to improve. So there's a meta-analysis that just came out a couple years ago. Again, this is out of Europe, and they talked about the 10-year revision rates of contemporary total ankle arthroplasties were 22%. And it varied quite a bit amongst the different types of prostheses that were out there. But in general, our 10-year revision rate was 22% in Europe. So not great compared to total hip and total knee patients. That's 5% or less.